Hi, I'm Dr. Alex Levin, Chief of Pediatric Ophthalmology and Ocular Genetics at Wills Eye Hospital. By the time you receive this video and this message from me, I'll actually be at the University of Rochester playing the same role. But my role with WAGR syndrome will continue. And WAGR syndrome, as you know, is a disorder that affects multiple genes side by side on the 11th chromosome. One of those genes is called the PAX6 gene. That gene is involved with the disease called aniridia. Now, the title of this talk is The Cornea in WAGR Syndrome, Keeping the Window Clean. I'm talking without slides because I think it's better for the Zoom type format, just so that we can talk one to the other on this chat. And I welcome you after this to send me any questions you may have. You can send them at alevin, A-L-E-V-I-N, at willseye, willseye.org. And that email will remain active after I switch from one role to the other. Why the cornea? Well, it turns out that aniridia is a misnomer. The word aniridia means without iris, but multiple parts of the eye are affected by this disease, this eye part of the WAGR syndrome. Perhaps the most difficult to manage part of aniridia is the cornea. The cornea is the crystal covering of our eye, like a watch crystal on top of a watch. It's basically invisible. If you stood to the side of someone and looked, you'd see that dome, that arc that's covering the eye over the pupil, which is the cornea. The cornea is a crystal clear structure, an amazing work of nature that is kept clear by the health of its inside layer of cells, called the endothelium, which pump fluid out of the cornea to keep the window clean all the time and allow crystal clear vision. But part of the cornea is the skin over its surface, called the epithelium. That skin, so to speak, is a layer of cells that is constantly being renewed, kind of the most living part of the cornea on top of the surface. You might have heard of people who get their eyes scratched. When you get a scratched eye, that's when the epithelium, the cells, the skin on the surface of the eye, get cleared away. And as you know, they could get cleared away, very painful for adults, but it heals within 24 hours, perhaps one of the most rapidly healing parts of the human body. How does that happen? These cells, these epithelial cells, are generated by the edge of the cornea. So if you look at my eye right now, you see the colored part of my eye. And through the middle of that is my pupil, the black hole in the middle that lets light into the back of my eye. At the edge of the colored part of my eye is also the edge of my cornea. If you think of my watch, the edge of my watch crystal is the edge of the cornea. And that edge is where it attaches to the white of the eye. That zone, the zone where the clear part touches the white part, is called the limbus. That's spelled L-I-M-B-U-S. The limbus is a very special area in the eye because it is the place that generates new cells to populate the skin on the surface of the eyeball. In order to do that, it needs a good copy of the PAX6 gene, actually 2 good copies. And we each have 2 copies of every gene in our body, but in aniridia, like all other autosomal dominant diseases, 1 copy is not working. And that's enough to make these limbal cells, or what we call limbal stem cells, unable to populate that skin and keep it healthy. You heard the word stem cell. And stem cell is an important word we read in the news and hear all the time. Stem cell simply means a cell in the body that has the ability to become other kinds of cells. All of us had stem cells when we were in the womb. Those are the kind of cells that generate the rest of the cells in our body. Some become liver cells, some become kidney cells, some become eye cells. And these cells on the limbus are the ones that become the epithelium, the surface covering of the eye. Without a healthy PAX6 gene, it's very hard for new cells to be generated. And what happens is that over time, this surface is unhealthy. And as it gets unhealthy, it allows blood vessels to grow into the cornea, which don't belong there. Normally, as I said, the cornea is crystal clear. If blood vessels are growing in, it starts to lose its clarity. The absence of the PAX6 gene is causing these limbal stem cells not to be healthy, to create a barrier for those blood vessels growing in. And when these blood vessels grow in, it makes the epithelium, the surface skin, irregular, uncomfortable, painful sometimes, causing patients to squint because the light bothers them, as it can't get through that very clear cornea that the rest of us have. This is a very, very difficult problem to treat. And again, I would think the most difficult problem in aniridia, because we just don't yet have a good treatment, although help is on the way. One other problem that patients with aniridia have is that if they get a scratch on their cornea, unlike the rest of us, where it is the rapidly healing part of the body, they can't generate the new cells to cover that little scratch. And a scratch could be there for a long, long time. Weeks, months, I've seen it even years. And when there's a scratch, you're also prone to infection, what we call a corneal ulcer. And those infections can leave scars, they can even be blinding. So trying to maintain a clear window, trying to keep that cornea clear in the face of limbal stem cell deficiency, an inability to generate new cells, is really the challenge in this disease. How do we do that? The number one and most foremost thing that we can do is lubrication. If you ask me, what's the prescription for a patient with aniridia? It's lubrication, lubrication, lubrication. And we do that with artificial teardrops or artificial tear ointments that your eye doctor can point you to. Almost all of those are over-the-counter products. If you go into a pharmacy, you'll see scores of different products. We prefer preservative-free treatment, either in the form of drops or ointment. It's recommended that you use artificial tears 3 or 4 times daily. And when problems are getting worse, or there's more difficult or more discomfort, which is often worse in the morning because our eyes dry out a bit while we're sleeping due to the lack of blinking, in that case, you might want an artificial tear ointment before bedtime to help lubricate the eye during sleep. It has been shown that lubrication can retard the development of problems. Whether it's going to stop getting those blood vessels in completely is hard to say, but we do know that kids who use these kinds of preparations do better and do have less symptoms. What do we do when things start to progress and they keep going and going and lubrication is not enough? One thing we can do is use what's called serum eye drops. These are eye drops that are actually made from the patient's blood, or in the case of children, sometimes from their parents' blood. The blood is drawn, it's spun down in a certain machine to separate the cells, the red cells, the white cells of your blood, from the liquid portion of your blood called the serum. And eye drops are manufactured from that serum, custom made, that are used usually 4 times a day. These seem to bring healthy juices, so to speak, to help those stem cells live a better life and perform better. And that can actually rapidly improve patients who have abrasions, what we call corneal epithelial defects, and maybe help maintain a better sense of lubrication and health for the limbal stem cells. What's the next step? Well, some patients really have chronic problems. The blood vessels are growing in, they get these abrasions, they get these little defects in the skin of the eye. Nothing that goes through inside to the eye, it's just the very superficial layer, but it can be quite troubling. And then we have to start thinking about alternate treatments. One might be, for example, that we would take a membrane, actually an amniotic membrane, that are harvested from babies after birth, the sac that keeps the baby inside. Those are taken and commercially generated into little thin strips that can be placed on the surface of the eye, kind of like a temporary covering. And there's many commercially available forms of that dissolve over time, or some that have to be put on and removed, different ways to do that. Sometimes we even sew the eyelids shut to create a permanent or semi-permanent covering of the eye, so it's bathing in its own tears all the time. Sometimes little plugs are placed in the holes on the inside part of the eyelid where I'm pointing. That's where tears drain off the eye. And by putting a little plug in there, it causes a backup of the tears to make the surface of the eye moist. All of these are treatments designed to try to supplement the work of the limbal stem cells, to supplement the lubrication of the eye, and try and slow down, if not prevent, some of these problems that occur. Cornea transplant is the ultimate treatment for someone who has an opacified cornea. But the problem is that in aniridia, it's a very hard operation to do successfully. Number one, if blood vessels are already grown into the cornea, it's going to increase the chance of rejection, because otherwise in a corneal transplant, the body doesn't know the new transplant is there. There's no blood vessels to feel that that new transplant is here, feel it chemically. The second problem is when you get a cornea transplant, you're getting from the donor all of the cornea except the skin. The skin comes from the patient. And we've already said that the skin is not forming well in aniridia, and therefore covering that transplant is a challenge as well. But the future has much to offer us. The idea of stem cell transplantation, putting healthy stem cells at that edge around the cornea, is already here. The problem is that's donor cells, and that requires getting medications to suppress your immune system to fight rejection of those cells chronically. And of course, there's side effects associated with that. New work done in part out of Georgia is showing a contact lens model of delivery of stem cells that's worked quite successfully in rabbits and will hopefully come to human use in the not too distant future. And lastly, we even have now in development an eye drop treatment for gene therapy, where by putting a drop on the eye with the correct PAC6 molecule, or actually more accurately, with chemicals that help in some patients overcome the mutation in the gene so that their PAC6 gene will work well, that will allow the gene defect to be created and the limbal stem cells to work again. So there's much to happen in the future. Science is progressing quickly. I think 10 years from now, we're going to be looking at a much different world than we are today for patients. But in the meantime, lubricate, lubricate, lubricate. I'm Dr. Alex Levin, happy to answer any questions at alevin, A-L-E-V-I-N, at willseye, WILLSEYE.org. And again, that email will remain active. I thank you very much for your time. Congratulations to the organizers on this fantastic conference, and thank you for inviting me. Take care.